On the Health Watch, more than 1 million people in this country will need angioplasty this year.
Traditionally, doctors reach the heart by entering the body through the groin, but UConn Health Center is doing things a little differently.
And the doctors there think their approach is safer. NBC Connecticut's Brad Drazen has the story.
Ed Habron of New Britain walks with ease now, but a few months ago, it was a different story.
I live on the second floor. It got to the point where I'd walk up to the second floor after walking the dogs and I could just about breathe.
A stress test revealed one of the arteries in his heart was 75% blocked. His daughter, Kathy, who's a cardiac nurse, sent him to cardiologist Michael Azrin at the UConn Health Center.
Make a fist for me again.
He sees patients with similar problems all the time.
The incidence of coronary disease is improving. I think that it's still very high, and it's one of the major causes of morbidity and mortality in this country.
Ed needed angioplasty, where a stent is used to open the artery.
I said, well, okay, if I need it, let's do it. Let's not wait till next year, let's do it now.
Most doctors reach the heart by snaking a catheter up through an artery in the leg, entering through the groin. But at UConn, doctors go through the radial artery, located on the wrist.
It's been a very successful program, and now it's our preferred access site on almost every patient.
Patients can sit up right after the procedure versus having to lay flat for hours after a traditional catheterization through the groin. For Ed, who's a former firefighter with a bad back, that certainly helped. Dr. Azrin also says there are fewer complications.
Most of the bleeding that occurs after a catheterization is from wherever we put the catheters in and have to take them out. And from the radial, it's almost doesn't happen. It's almost zero.
They've been doing it like this at UConn for a decade. So why hasn't it caught on at other facilities?
It is more difficult, and there's a learning curve, and I think once people have done enough, then they can do it safely and efficiently.
As for Ed, he's happy to have his health back.
Feel fine now. Breathe a lot better. More comfortable. I can walk my dogs without killing myself.
Brad Drazen, NBC Connecticut News.